Mr. Investor, welcome back to the channel, baby. In this video, we're going to be talking about none other than bio-nanogenomics. We will be talking about cancer and screening, rare disease, jobs opening up in genomics in the UK, some events that are happening in July and August, link-ups in Europe which could drive adoption. Please remember, none of this is financial advice, it's for entertainment only. And if you'd like to support the channel, please join channel memberships. It's only 99 cents a month. And also hit this video with a like, hit the subscribe, and click the notification bell so you don't miss any videos like this. So let's get into it. In bio-nanogenomics' latest corporate overview as of July 2022, they remain focused on cancer and rare disease. On slide 5, essentially every patient who undergoes evaluation for cancer or genetic disease should be tested for structural variation. Structural variation analysis is first-line patient management according to medical guidelines. We've heard it time and time again from bio-nanogenomics. They say cancer is a disease of structural variation. So as we know, cancer's onset and progression can be triggered by the accumulation of structural abnormalities in the genome. Some of these somatically acquired large structural variations can lead to cancer onset by, for example, deactivating tumor suppressor genes or upregulating oncogenes. In 2022, the UK government alongside the Welsh and Scottish governments decided to commit to better outcomes for patients through better genomic testing and access to clinical trials. Now these guys want to implement their plan between 2022 and 2025, and they were focusing on cancer. They want to improve cancer diagnosis and treatment by working across the UK to better integrate genomic testing into healthcare. And if we go to the 2nd May 2022, you can see NHS England shared this article saying a record year for people receiving life-saving NHS cancer checks. There was over 3 million people within the last 12 months who went for cancer checks. This is the highest year on record, and the NHS health chiefs continue to encourage people to get checked for cancer. They've been doubling their spending on cancer awareness campaigns, and they continue to encourage people to come forward for checks. A lot of people more concerned about their health now, so there's an increasing demand for cancer checks. So the NHS is investing in not only innovative technology, but also mobile clinics, cancer symptom hotlines. They've even got a man van program where they provide free healthcare checks for men. They want to improve their early diagnosis rate for men, especially with prostate cancers. The National Cancer Director for NHS England, Dame Callie Palmer, said that they're really accelerating towards, their ambitions to diagnose more cancers. They want to go further and faster so they can reach it at an early stage and save more lives. And they said this can't happen overnight. They need to invest in extra diagnostic and treatment capacity to meet increasing demand. And now let's talk some shmoney, let's talk some figures. In terms of diagnostics, they're going to invest around £2.3 billion into expanding diagnostics, £1.5 billion into treatment. Most of this is focusing on cancer. And take a look at this figure. They want to deliver 17 million diagnostic tests over a 3-year period. And when bio-nanogenomics announced that they had adoption of the Sapphire system in 2 key sites within the UK, within the National Health Service, the plan was, according to Eric Homelin, to create a reliable, cost-effective solution for detecting chromosomal abnormalities in blood cancers, genetic conditions, and cancer research applications. And if we look at the statistics from bloodcancer.org.uk, within the UK, 1 in 16 men and 1 in every 22 women will develop blood cancer at some point in their lives. Currently, over 40,000 people are being diagnosed with blood cancer every single year, some people too late. When I was working on a placement, someone came into ICU, he collapsed, they didn't even know that he had blood cancer. In terms of the US, we can see it accounts for about 10% of all diagnosed cancers in the US each year. When we look at cancer that affects children, we can see childhood leukemia accounts for about 25% of all cancers in children. Within the US, there's a figure here from 2020 stating that 178,520 people will be diagnosed with blood cancer this year in the US. Now going over to Spain, we can see here that Chloe Tesarillo announced that for the first time ever, there's a Spanish user group meeting of bio-nanogenomics optical genome mapping. These guys were sharing their experience with the machine. Then if we take a look here, this was very interesting. There was actually 60 national experts. They had a meet at the Joseph Carreras Institute to discuss the present and future of optical genome mapping. These guys, by the way, are national experts in cytogenetic diagnosis of leukemia. So first ever meeting organized in Spain, more than 60 experts came, and according to one of the organizers of the event, Dr. Francesc Sol, or his name Soleil, the whole plan was for people who are using the machine to express their vision of the emerging technology, as well as others who are curious about the machine and don't know about it and are interested in using it. Apparently they had some really good discussions and people were commenting on the advantages but also the drawbacks of optical genome mapping. They said with no doubt optical genome mapping is undoubtedly They said no doubt optical genome mapping is undoubtedly a very promising tool, and meetings such as this one with experts in cytogenetics are a very important step into learning how far its possibilities will go in clinical application. Moving on, let's take a listen to this. This is from HEE Genomics Education Program, and they're currently exploring using genomics to diagnose rare genetic conditions.
For instance, 1 in 17 people have a so-called rare disease, and 80% of these have a genetic or genomic basis.
There's also been a lot of talk about genomics being implemented and training up our general practitioners. So in the UK, we call them a GP. If I have any health worries, any anxieties about my health, I just go and visit my doctor, my GP. In the US and North America, they call it a family doctor, I believe, or a primary care physician. So now in the UK, they're using genomic medicine and they want to train up the general practitioners. There's loads of courses now becoming available where they want to train up the GPs, and they're stating that the training of the general practitioners on genomics is core to effective delivery and use of this revolutionary technology that's becoming more accessible to the public. They said this will enable GPs to predict, prevent, diagnose, and treat disease. Now jobs. There are jobs springing up in Oxford, in London, in Leicester, and in the UK they're focusing and using whole genome sequencing. So they're using this particularly for the NHS patients with rare genetic disease or certain types of cancer. They're now eligible for whole genome sequencing, a new technology which aims to improve diagnosis and treatment stratification. They're really building out and wanting to support, embedding genomic medicine into the NHS. And remember, this was said, 75% of structural variants that are present in a person's genomes are missed by whole genome sequencing. They're missed. Can bio-nanogenomics be the key? With the 100,000 Genome Project, remember there was 1,309 families without a diagnosis. Joe Butler was stating maybe it's time to look at what Sapphire can add. This was the former UK business manager. In terms of the events that are coming up, take a look at this. The Cancer Genomics Consortium. Bio-nanogenomics is going to be presenting with a lot of different people, a lot of doctors, a lot of researchers who have used the machine. This is going to be across July the 31st, 2022 and August the 1st, 2022. You may see some familiar names such as Rashmi Kanagal-Shamana, Adam Smith from University Health Network. Interesting, International Working Group recommendations for the implementation of optical genome mapping in blood cancers. There's also Thoy Thung, identification of novel genomic structural variations in angiosarcoma by optical genome mapping. We also have Nikhil Sahajpal from Augusta University. And to end the evening, Bio-nanogenomics is one of the diamond vendor showcases here, talking about optical genome mapping and its integration with next generation sequencing for clinical research in leukemia and lymphoma is Alka Chowdhury, Ravindra Kohli, Yasmin Akare, and Rashmi Kanagal-Shamana. So thank you very much for watching. Before we finish up, please remember none of this is financial advice, for entertainment only. Hit me with the like, hit me with the subscribe. Let me know your thoughts and feelings in the comments down below. If you're able to support the channel and you can afford to do so, please click the join button above my head. Any donations are also welcome via PayPal. Really appreciate you guys. I'm in this for the long run. I've got 10,000 shares of Bio-nanogenomics now. I don't have a job at the moment, so I'm just working on content creation, and I want to just keep learning and researching as much as I can. In the long term, entertainment only, this is not financial advice, I believe that bio-nanogenomics is going to do well. That's my belief. That's why I invested in them. With some key adoption already in place, I believe bio-nanogenomics has a very unique product. And like these guys have stated, they believe the market opportunity for OGM right now, so current addressable market range, is between $2.8 billion to $4.2 billion. They said there's 15,000 sequences out there installed worldwide. The optical genome mapping Sapphire can complement 4.2 million samples in cytogenomics, and that's on an annual basis that they are analyzed. But we've also got these right here: screening, fertility, newborns, potential expansion opportunities in these markets. So population genetics, screening, cell bioprocessing, and liquid biopsy. These guys are aiming for 240 OGM systems by the end of the year. They have 176 systems installed as of Q1 2022. I'm excited to see their progression because they said there's a backlog, as we can see here. But one of the things I can tell you about is we ended the quarter with several systems that were in a backlog for installation. So we should see them start to catch up over the next few quarters. I'm super excited. Let me know your thoughts and feelings, and thank you for watching. Mr. Investor Lot, over and out, baby.